Hello. In this video, I would like to talk about the causes and symptoms of diabetes. Obsession with food contributes to the disease. The food we eat is transformed into a readily absorbable form of glucose as it passes through the stomach and intestines. Glucose is absorbed into the bloodstream and becomes the source of energy for our bodies. The glucose concentration in the blood is called blood sugar or blood glucose. Blood sugar is regulated by insulin. Insulin is a hormone secreted by the beta cells of the pancreas that helps maintain a stable level of glucose in our bodies. However, diabetes occurs when insulin is not secreted or when insulin fails to perform its function, resulting in the accumulation of glucose in the bloodstream. In severe cases, glucose may be excreted in the urine. Hold on a moment. If you subscribe, like, and enable notifications, you can quickly receive diet and health information. Diabetes can be divided into two main types. Type 1 diabetes occurs when the body mistakenly attacks and destroys the insulin-producing beta cells, leading to a lack of insulin secretion. Type 2 diabetes occurs when insulin is produced but doesn't function properly. The most common type of diabetes we refer to as type 2 diabetes. The onset of type 2 diabetes is caused by various factors and is often associated with aging, obesity, a sedentary lifestyle, and a preference for fatty or sugary foods. Genetics also plays a fundamental role in the development of diabetes. Genetically, our bodies may not respond well to insulin. As we age and gain weight, if our bodies cannot produce enough insulin to overcome insulin resistance, diabetes develops. A critical concept in diabetes treatment is glycated hemoglobin, HbA1c. Glycated hemoglobin refers to red blood cells that have been exposed to glucose. Since red blood cells live for about 120 days in our bloodstream, analyzing glycated hemoglobin provides an average blood sugar level over the past 120 days. Our red blood cells contain a substance called hemoglobin, which carries oxygen. When blood sugar levels are high, glucose attaches to hemoglobin, forming glycated hemoglobin. Our red blood cells have a lifespan of approximately 3 months. Therefore, glycated hemoglobin reflects the average blood sugar status over a period of 2 to 3 months. In standard cases, a value below 5.7 is considered normal, while a value equal to or above 6.5% is indicative of diabetes. Maintaining glycated hemoglobin, HbA1c, below 7% is considered the goal of blood sugar management, as it is believed to prevent complications from occurring. Isn't it a problem to take diabetes medication for a long time or even for a lifetime? Here, we need to consider a few things. We are discussing the prolonged state of uncontrolled high blood sugar versus the potential side effects of taking medication. Every medication has its side effects, some of which we are aware of and some that we may not know. However, taking medication and regulating blood sugar levels to prevent complications of diabetes is far more beneficial. That's why we recommend medication therapy. The reason for impaired vision is the accumulation of blood in the eyes. After retinal blood vessels are damaged, new blood vessels form and spread, blocking the passage of light through the eyes. Diabetes is a disease characterized by high blood sugar levels, which continuously damage blood vessels. The retina, which acts as a film in our eyes, contains numerous delicate blood vessels. When diabetes is present, these tiny blood vessels are prone to damage. Diabetes is often referred to as a silent killer, but its lack of obvious symptoms may lead to underestimating its severity. However, when complications arise, it can be terrifying. Imagine not being able to see. Imagine not being able to see your own urine and needing dialysis. Or imagine your feet decaying to the point where they need to be amputated. It is incredibly painful. Furthermore, the risk of myocardial infarction, heart attack, and stroke significantly increases with diabetes. It is a frightening disease. Complications do not appear immediately but rather after 10 or 20 years, which may lead to a lack of awareness. Especially in younger individuals who have diabetes but no symptoms, often neglect proper management and end up experiencing complications. For the brain to function normally, it requires a significant amount of glucose. In healthy individuals, the brain receives an adequate supply of glucose as needed. However, during treatments that lower blood sugar levels, if there is an excessive amount of insulin and the brain does not receive sufficient glucose supply, the brain sends warning signals. Hypoglycemia, or low blood sugar, can result in dizziness, cold sweats, and tremors in the hands and feet. In severe cases, it can lead to loss of consciousness and even death. Hypoglycemia refers to blood sugar levels below approximately 70, and when it occurs, a carbohydrate intake of 15 grams is required to raise blood sugar levels. In the case of individual sugar cubes, it is 3. For candies, it's 3 pieces, and for juice, it's half a cup. Additionally, you can purchase glucose tablets in pill form from a nearby pharmacy and take them. Excess fat accumulated in the abdomen hinders the action of insulin and suppresses the function of beta cells in the pancreas, leading to the development of diabetes. Obesity is one of the most dangerous factors that causes and worsens diabetes. If diagnosed with diabetes, it is essential to receive treatment. This does not necessarily mean medication therapy. Lifestyle modifications are, in fact, the most important. Dietary adjustments and exercise efforts to lower blood sugar levels are paramount. That concludes today's video. Please subscribe, like, and enable notifications if you found this video helpful. We will return with even better content next time. Thank you for watching.